Good afternoon, my name's Dr. Sam Jones and I am the current Head of Service for the Children's Emergency Department. So here in University Hospitals of Leicester, we serve the community of Leicester, Leicestershire and Rutland for the under 16s. We have our own purpose-built emergency department for children, and the entrance is separate to that of the adult department, which is on the other side of the building. We see all sorts of children here, from children that need primary care type problems, so things that would traditionally be seen in a general practice, right the way through to the resuscitation of critically ill children, and we're very proud of what we've achieved here. I'm part of a wider team of clinicians, nurses and allied medical professionals, so people that you might meet can be from very different backgrounds. So the department is always supported by a senior consultant, and that may be a paediatrician with a specialty interest in emergency medicine, an emergency medicine consultant with a specialty interest in paediatrics, or an emergency medicine consultant of whom 25% of their workload has always been the care of critically unwell children. On top of that, we have a senior band of nurses. So there's Andy Koza, who is the matron for the Children's Emergency Department. We have currently three Band 7 nurses, Amy, Sue and Debs, who help support their team of nurses, of which we have paediatrically trained nurses, we have children's trained nurses who have done some form of additional training in paediatrics, and we have adult trained nurses who work through in our part of the department as well. In addition to the senior nurse and senior clinician team, there are emergency care practitioners who are paediatrically trained in both medically unwell children and children with injuries, and we have a wide range of additional staff from the HCAs, porters and reception staff, and everybody's here to help you, so welcome to the department. I'd like to talk you through a journey of our patients. So patients, the principle of our department is that the patients can come to a specifically built children's emergency service, and what previously happened before we opened in April was that children needed to walk around UHL and find the service that they required, but this has changed with the opening of our department. So now children come through one door and the services that they need are provided here. So as they come through our main entrance, they will be visually assessed by a nurse who is sat at the front desk next to the receptionist to make sure they're safe to wait. The receptionist will book them in and ask them to take a seat. All children that present here, no matter what they come with, will be assessed by somebody who's trained in the assessment of children to make sure they get seen by the right person in the right place, and that happens in rooms 5 to 9. Some of those children will continue through to the Paediatric Majors department, some will go through to the Paediatric Minors department, and some will be put in the primary care stream. Some children will be pulled straight through from assessment through the back door into the department, and others will be asked to take a seat in the waiting room. Rooms 1 to 4 are where the primary care doctors see the patients, so they will see the patients in that area that hopefully will be discharged on a quick turnaround. So paediatric majors, these tend to be children with illnesses, and we try to see them in rooms 10 to 19. I'd like you to just know about a couple of extra rooms. So the 3 rooms in front of the nurses station are our high dependency rooms, and that's so that we have got closer visualisation of the more unwell child. We do use these rooms at other times, so if we're full and there are not particularly unwell children, we'll use them as normal majors bays. But if there is somebody that needs a closer eye, then we would tend to put them in those 3 bays there. In addition to those rooms, I'd like you to know about room 16 and room 18. Room 16 is our specially facilitated mental health room, which has a 2-way mirror on it and an office, so that we can observe the patient from a distance, such that if our presence in the cubicle causes them increased distress, we can step back a bit but still make sure they're safe. Room 18 is our charity enhanced sensory bay. This is for children with enhanced requirements, where we've been fortunate enough to have facilities built so that they can have some sensory distraction and reduce the distress of being in the department. And some of that kit's mobile, so we can use it in other parts of the department as well. Obviously, with a department the size that we are and the amount of the geographical area that we serve as a population of under 16s, we unfortunately have to look after the critically unwell child as well. There's a whole system of pre-alert so that if the paramedic at scene feels the patient's really at risk, they'll ring through and bring the child with their family members through the resuscitation entrance into the emergency room. We have 4 dedicated bays within the emergency room that can be used for both adults and children, but primarily rooms 1, 2, 3 and 4 are set up and able to look after the critically unwell child. But that's not the end of the story, unfortunately. Because our children are so small, often their parents will scoop and run, so they'll pick up their child and they'll drive them to the hospital and not always feeling able to wait for an ambulance. And that means sometimes we have critically unwell children in arms present to the front desk and reception. And that's the role of the VAC nurse. If the VAC nurse identifies that somebody's really unwell, or that's picked up in assessment, those children will be brought through. And therefore you may be asked to just initially help, but don't worry because you're never on your own. Those children will be quickly stabilised in the HDU bays if that's appropriate, or taken straight through to the resus room, and we would predominantly use bay 1, which has all the equipment that's needed. If you're a junior member of the team, you won't be expected to work in resus, but you may just need to know about the immediate management of any patient that comes through, and we'll cover that off in induction. So you won't be on your own, but you may be asked to just put a little bit of oxygen on. Once you put the oxygen on, you'll be surrounded by experienced members of the nursing team as well, and the call will have already gone out for the senior doctor. We'll teach you about the basic first aid management of a child who's critically unwell on your induction day with us, so you won't be left to sort these patients out on your own. The call to the senior doctor will mean that there is always a senior doctor across the emergency floor 24/7, and they will be at your side very soon. So the Paediatric Minors Department runs out of bays 20 to 24. We use the rooms interchangeably. They tend to be patients who can come into the room and be asked to step out again, and they are bays rather than rooms, so that which goes along with the fact that the patients are a faster turnaround. It tends to be where we put our minor injuries patients, but as we send somebody round to X-ray, we may ask them to return from X-ray to sit in our subweight whilst we see another patient in the bay. The thing of note though is don't worry about the numbers, because as the seasonality of paediatrics changes, so from the winter where we tend to see more medical patients and the summer where we see more trauma patients, the bottom line is see the patients wherever you can, trying to keep within those room numbers, but it really doesn't matter. We'll flex up and flex down, and that's why the department was designed this way. We've got a treatment room, room 25, which is where if you're going to do a painful procedure on a child, which would distress not only that child plus the people in the neighbouring bays, we ask you to take the patient round to that room and do your procedure in there. And then finally we've got the Children's Short Stay Unit. This is a new facility to Leicester where we place children who are going to stay for under 18 hours. It tends to be open from 10 in the morning to 10 at night, although the long-term aim is to open it 24 hours, and you never know, that might be introduced in your time with us. The way to get onto the Children's Short Stay Unit is by signing a pathway, and this is where your senior clinician comes in. You're never in here on your own, and there's always some help to be provided by the senior clinician, because paediatrics as a specialty is a senior-led service. So you'll be asked about a patient, and then you'll be asked to fill out a pathway, and that'll make sure the right patient gets onto the unit. When the children go into the short stay unit, they remain under your care, and that's why it's just through a set of double doors at the end of the department. So if you're seeing a patient and their 4 hours has run up, but you need a longer period of looking after them, and that's been signed off by a senior, we'll place the patient on the children's short stay unit stream, but you'll need to know when you need to go back and look after them, and the nurse will need to know who you are so that if there's any concerns, they know who to contact. And that's us. Welcome to the Children's Emergency Department, and we hope your time with us will be most enjoyable.